Hello friends, welcome back to Complete Medical Coding. Today let's discuss few integumentary mock questions, few guidelines from the integumentary session. Okay, friends, if you are new to the channel, please support me by subscribing to the channel, and hope you are liking all my previous videos. If you have any queries or clarifications, you can mention me, mark it in the comments. So let's move to the questions one by one. Let's move to the first question. A 50-year-old male presents in the office with an ingrown toenail on the right and left foot. The procedure was discussed in detail and the patient elected to have it performed. The right foot was prepped and draped in sterile fashion. The right great toe was anesthetized with 50-50 solution of 2% lidocaine and 0.05% marcaine. A mini tourniquet was placed around the toe for hemostasis. The lateral border was incised and excised in total. Phenol was then applied. The toe was then flushed. Tourniquet was released and dressing applied. At this time, the patient elected to have only one performed and will return in 2 weeks for the left foot. Quote the procedure. So here what is the procedure? Ingrowing toenail. The procedure, before the procedure done, the doctor advised him to do to remove the ingrowing toenail of both left and right foot. But after doing only one, like which side has been done? Right toe. First the right toe was done, right? So after finishing the right toe, the patient told the doctor that I'll be coming back after few weeks for the left foot. So here bilateral is not done, only right foot is done. Okay, so we have to code for the procedure. Let's move to the codes one by one. Open the CPT code book, go to the first code 11765. See what are the series mentioned here in the options. 11765, 750, 760 and 740. Let's do call those four. 740, 50, 60 and 65. Let's check which is the correct answer. Okay. What is 11740? Evacuation of subungual hematoma. No, it's wrong. 11750. Excision of nail and nail matrix. Yes, this is excision of nail, right? The ingrowing nail or toenail removal, that is excision only. The procedure is excision always. Okay, excision of toenail. So excision of nail and nail matrix, partial or complete. Example, ingrown. It's written in the mentioned in the bracket as ingrown or deformed nail for permanent removal. Okay. So 11750 is excision of toenail, excision of nail and nail matrix, partial or complete for ingrowing. Okay, 750. What is 760? 760 is repair of nail bed. This is not a repair of nail bed. Okay, this is excision of ingrowing toenail. So that's also wrong. And 11765 is wedge excision of skin of nail fold. Example for ingrown toenail, wedge excision. This is simple excision, not wedge excision. This is permanent removal. So excision of nail and nail matrix. So the correct answer is option B, 11750 is the correct code. Excision of nail and nail matrix for ingrowing toenail. Okay. Anyway, in the description, it's nothing mentioned as bilateral or unilateral, so we don't have to append any modifier. Okay, or we don't have to code it twice because we have done only one foot. Since there is nothing mentioned in the code, we can leave it as such. So the answer will be option B, 11750. So let's move to the second question. A 64-year-old female who has multiple sclerosis fell from her walker and landed on a glass table. She lacerated her forehead, cheek and chin, and the total length of these lacerations was 6 cm. So here this is the first section, forehead, cheek and chin, laceration. Okay, total length is 6 cm. Her right arm and left leg had deep cuts measuring 5 cm on each extremity. Means right arm 5 cm and left leg 5 cm. Okay. Her right hand and right foot had a total of 3 cm lacerations. So right hand and right foot 3 centimeter. The emergency department physician repaired the lacerations as follows. So this is how the physician has doing the laceration. The forehead, cheek and chin had debridement and cleaning of glass debris, with the lacerations being closed with 60 Prolene sutures. So this is the first part. The emergency department physician repaired the first part. The first section that we have to code is for the forehead, cheek and chin, okay, which is debrided with 60 Prolene sutures. Then comes the next step, the arm and leg, okay. The arm and leg were repaired by 60 Vicryl subcutaneous sutures and Prolene sutures on the skin. The hand and foot were closed with adhesive strips. Select the appropriate procedure codes for this visit. So here there should be two codes, two section of codes. Like the first one you have to code for forehead, cheek and chin, and then comes the hand and leg. Okay. So let's check the CPT codes one by one. But before that, I think I'll tell you an easy method to find, to save time in this question. See, forehead, cheek and chin. Forehead, cheek and chin, it comes in one part, right? So it should be, if you can check the CPT code book also, all these will come in one section, in one part. So the total is 6 centimeter. Then right arm, left leg, 5 centimeter each, means 10 centimeter total. And then right hand, right foot, total of 3 centimeter. That is together 3 centimeter. Okay. So you have to total out how for getting the answer. Anyway, for the first part it is 6 centimeter. So let's check where is this 6 centimeter coming for the first part, the first section. Okay. What is the first CPT code? 12014. Okay. What is 12014? So here the first part is actually 3 parts. 3 procedure has been done here. The first part is the laceration of forehead, cheek and chin. Forehead, cheek and chin, since it comes in one part, you can you should code it as a single code. Okay, forehead, cheek and chin together. Laceration is 6 centimeter. So you have to code for the 6 centimeter measurement. Then comes the right arm and left leg. Right arm and left leg had deep cuts measuring 5 centimeter on each extremity. So it means right arm 5 centimeter and left leg 5 centimeter. Total will be 10 centimeter. Okay. Then comes the right hand and right foot had a total of 3 centimeter. But then for that hand and foot, what did the physician did? See, the ED physician, emergency department physician, did laceration as follows. The first one is forehead, cheek and chin, had debridement. Okay, and then cleaning of glass, lacerations being closed with 60 subcutaneous Prolene sutures. Then the second part is arm and leg. Arm and leg were repaired by 60 Vicryl subcutaneous sutures. And then the third one, hand and foot. Hand and foot were closed with adhesive strips. It means the third section, the third part, hand and foot, which means the right hand and right foot, which were closed with just the strips, because it was small only, 3 centimeter laceration only. So it was closed with the strips. There was no suturing done on the third part. So we don't have to code that. Since there is no suturing done, we don't need to code that. But we have to code for the other two. Okay. So for the first section, forehead, cheek and chin. Let's look into the codes one by one. What is 12014? 12014 is simple repair of superficial wound of face, ears, eyelids. How much is centimeter? 5.1 to 7.5. Yes, we need 6 centimeter. It comes in between this code. But is this a simple repair or an intermediate repair or a complex repair? I had already mentioned before when I had taken the class 4 integumentary session. It's in the previous episodes. You can check from the beginning. So in that, another name for simple repair is layer closure. Another name for intermediate repair is layered closure. Another name for complex repair is extensive. Apart from that, if in the question if it is mentioned subcutaneous sutures, subcutaneous means the suture has been done till the subcutaneous tissue, which means many layers are present, right? So that will come under intermediate repair. If it is only one layer, it will be a simple repair, means simple suturing. If it is a simple suturing or simple repair of the skin, like not layer wise, then it will be a not layer wise wound, then it will be a simple repair or layer closure. But if it is mentioned subcutaneous in the question, it means it is intermediate repair. It's an intermediate repair, okay, or layered closure. Both words. Okay. So since here in the question it is written subcutaneous sutures, for both the procedures you have to code for intermediate repair. So 12014 is the incorrect code. So you can skip the first option. Now move to the second one, 12053. What is 12053? Repair of intermediate wound. Yes, this is what we need. Okay. Repair of intermediate wound of face, ears, eyelids, nose, lips. Yeah, this is what we need. Face, fully coming under the face. 5.1 centimeter to 7.5 centimeter. We have 6 centimeter. Ours is 6 centimeter. So this is the first CPT code that you need to code, 12053. Now, what is 12034? Now we have to code for the second part, that is right arm and left leg. 5 centimeter on each extremity. It means total is 10 centimeter. Okay. So what is 12034? Same, intermediate repair, because this is also mentioned as a subcutaneous suture. So repair of intermediate wound of scalp, axillary trunk or extremities, excluding hands and feet. So hands and feet are not included. This is extremities. Yes, this is on each extremity it is mentioned. So 12034 is 7.6 centimeter to 12.5 centimeter. Ours is 5 plus 5, 10 centimeter. So this will be our correct code for the second section, 12034. Now, what is 12002? 12002 is simple repair of superficial wound of scalp, neck, axillae, including hands and feet, 2.6 centimeter to 7.5 centimeter. But do we really need to code this as simple repair? No, because suturing is not done on the third section. Third section is 3 centimeter laceration, which is present in the CPT code 12002. But the suturing has not been done, so you cannot call it as a repair. The doctor has just closed it with strips, the bandage. So you cannot code this one. So this code should not be there in our answer. So what should be our answers? The two CPT codes, 12053 and 12034. Second part you have to append it with modifier 51 because it is a multiple procedure. Both like different parts, right? So it's a multiple procedure. So what will be the correct answer, correct option? It is option D, 12053 and 12034 with modifier 51. Okay. Little confusing, but you will get it. If you read the question 2-3 times, you will surely get the answer. If you have any queries, you can mark it in the comments. Okay. Now moving to the third question. A female patient had an FNA biopsy. FNA, fine needle aspiration. Okay. Biopsy with ultrasound guidance on 2 separate nodules in the upper outer quadrant of left breast. So which part is FNA done? FNA biopsy? Upper outer quadrant of the left breast. What CPT and ICD-10 codes are reported? So here the procedure is FNA biopsy, fine needle aspiration biopsy with ultrasound guidance. Okay. And then, yeah, 2 separate nodules are present in the upper outer quadrant, means lump type thing is present on the upper outer quadrant of left breast. That is the ICD code. So let's check the codes. Let's find out the ICD code first. What is N60.21? In option A, N60.21. Fibroadenosis of right breast. No, that is wrong. What is N63.21? As in option B. Unspecified lump in the left breast, upper outer quadrant. Yes, this is what we need. Left breast, upper outer quadrant. So N63.21 is our correct ICD code, which is there in options B and D. So let's find out the CPT code now. What is 10005 and 10006? 10005 fine needle aspiration biopsy, FNA biopsy, okay, including ultrasound guidance, first lesion. First lesion. There are two separate nodules present in the question. So you have to code two codes. 10005 is first lesion and 10006 each additional lesion. That's how it should be coded. And no need of reporting it with any modifiers. See, in the bracket down it's mentioned, do not report 10005, 10006 in conjunction with 76942. Means along with the ultrasound, you should not code it. Means it is already included, the ultrasound guidance. As in the description it is mentioned 10005. FNA biopsy including ultrasound guidance. So we don't have to code separately for ultrasound, okay? And no need to add any modifier. So you already got the answer. And in option D, if you can see, it's 10005 and again 10005 by adding 59 modifier. No, that is wrong. It should be 10005, 10006 as the CPT codes and then ICD code N63.21. So you got the correct answer, it's option B. Okay. Now let's move to the fourth question. A 76-year-old has dermatochalasis on bilateral upper eyelids. So this patient is having the diagnosis as dermatochalasis, bilateral upper eyelids. Okay. A blepharoplasty will be performed on the eyelids. So it means the procedure is blepharoplasty, which is performed on the eyelids, means bilateral eyelids it is mentioned. So both eyelids, okay. A lower incision line was marked at approximately 5 mm above the lid margin along the crease. Then using a pinch test with forceps, the amount of skin to be resected was determined and marked. An elliptical incision was performed on the left eyelid and the skin was excised. In a similar fashion, the same procedure was performed on the right eye. So, same procedure has been done on both the eyes. That was just how the procedure was carried out. Okay. The wounds were then closed with sutures. What are the correct CPT codes? So, we don't have to code for any diagnosis. They are asking only the CPT codes. What is the procedure here? Blepharoplasty, both upper eyelid, bilateral. Simple, right? So, go to option, the first one. First code 15822. 15822 is blepharoplasty upper eyelid. Ours is, yes, upper eyelid. And what is 15823? Blepharoplasty upper eyelid with excessive skin weighting down lid. There is nothing mentioned in the question that excessive skin weighing downward or down lid. Okay. So you don't have to code 15823. You have to use the code only 15822. And below that, in bracket it is mentioned for bilateral blepharoplasty, we have to add modifier 50. So 15822 with modifier 50 should be our answer, which is in option C. 15822 with modifier 50. Blepharoplasty bilateral. Okay. Now let's move to the fifth question. The question is little, this is a descriptive type question, okay. But you can easily score answer for descriptive questions if you read the question carefully. And okay, let's see. Let's move to the question. Chief complaint. Patient presents today for pairing of calluses that have formed on the fifth toes of each foot. Patient is an avid runner who averages 10 to 15 miles daily. Calluses continue to form as observed over previous visits. Patient is unable to effectively train for upcoming marathon due to increasing discomfort. Dermatologic review of systems. Positive for painful skin abnormality of the fifth toe of both the right and left foot. Physical exam, vital signs BP 110 by 100. Integumentary, visual examination revealed thick calluses on both the right and left foot. Okay. Raised, thickened and extremely tender to touch. Area is pale yellow in color. Each callus measures 2 cm in size. Shape is round. Arrangement is isolated and has a well demarcated distribution. Status is worsening due to continued vigorous physical activity. Procedures. What are the procedures? Lesion, excision or shaving. Explanation of procedure given and consent obtained. Lesion prepped and draped using sterile technique. Anesthetized using Lido 2% with sodium bicarbonate 10:1 solution. Less than 1 cc was administered to both left and right fifth toes. A 2 cm hyperkeratotic lesion including margins on both the right and left fifth toe were removed via paring method. Assessment or plan. Removal of hyperkeratotic lesion from the left and right fifth toes. Await pathology. Specimen sent to lab. Antibiotic ointment was applied and toes wrapped with sterile dressing. Patient advised to abstain from running for 2 to 3 days and to wear an additional pair of socks when running to prevent or slow callus formation in the future. What CPT and ICD-10-CM codes are reported? Okay, so what is the procedure here? Paring or cutting of calluses. And sorry, not ICD. The procedure done was paring or cutting of calluses, the thickened tissue. Okay, and what is the diagnosis here? Calluses. See, excision was the procedure done here. If you can see in the last, almost in the mid. Initially, the patient came for paring of calluses. Doctor had checked, and then doctor has removed that calluses from. See, on visual examination, it was written thick calluses was found on both right and left foot. Okay, each calluses measures 2 cm in size. So, status is worsening due to physical activity. Procedure done was excision. And here, from both left and right to fifth toes, the calluses was removed. Removal of, so that is a procedure done, the procedure done here. Removal of hyperkeratotic lesion from left and right fifth toes. Okay. Anyway, let's find out the CPT code first. CPT or ICD, whatever you want. We will not code this 99213 because, see, as mentioned in option A and D, because it's an E&M code. This is not an office visit code. We cannot code an office visit code. Okay. So just keep those two options because those two answers are incorrect. Let's move to option B and C. 11055 and then 11056. We'll find the CPT code first. What is 11055? Paring or cutting of benign hyperkeratotic lesion. Example, cones or calluses, single lesion. And then 11056 is 2 to 4 lesions. Here how many has been removed? 2 lesions, right? From left and right. So it means 2 lesions has been removed. So in option B it is mentioned 11055 into 2. No, we already have an add-on code as 11056. So you should not code primary times 2. If there is an add-on code, you should not mark 2 primary codes. So 11055 times 2 is incorrect. Okay. Sorry, not add-on code. I mean the exact code. 11056 is, it's not an add-on code. I'm sorry. That is the exact code, exact description. Paring or cutting of benign hyperkeratotic lesion. 2 to 4 lesions. Since we have 2 lesions, the exact description as of 11056 as 2 lesion, you have to mark only 11056, which is in option C. Option D, anyway, since E&M code is there, we will not use that. That is wrong. So, see, we already got the answer as option C. That's how you can find the answer easily for descriptive questions. Okay. So, 11056. And what is the ICD code? L84. In option C itself. L84 is cones and callosities. Since our question is, diagnosis is callosities, right? Calluses means callosities. So the correct answer is option C, 11056, and diagnosis L84. Okay. Hope you can able to understand this. So friends, these are few questions. If you find this video useful, please like and share. And if you have any doubts or any clarifications, please mark it in the comments and I'll get back to you as soon as possible. Okay. I know few questions are little, it will take time for you to understand, especially for the new students. So for this type of descriptive questions, you need to carefully read the question. If you can understand the question, then within 1 or 2 minutes you can find the answer also. Okay, answer will be, finding out the answer for descriptive question is very easy. The only thing is what you need to understand what is mentioned in the question. That's it. So friends, if you are new to the channel, please support me by subscribing to the channel, and if you like the video, please like and share, and thank you so much for all your support. So stay tuned for more videos, more questions. Thank you. Bye. Take care.